Hello.
Hi.
How are you doing
Oh,
today?
pretty good.
Well, great. So we're here at Dr. Rose's house and system. So you've been using that EE system for a very long
Yeah, it's
time.
been probably about 8 years.
Wow. And talk to us about the AE system and what did you find out about and what do you do?
Well, when I first got involved with it, because I'm a professor and I run the department, I run the clinic for the Department of Complementary and Alternative Medicine at the medical school in Hawaii.
Wow.
I have to make sure that there's some kind
Legitimacy perhaps?
of course,
Yeah.
some peer-reviewed support.
Yes.
And among her papers, she had a paper by Dr. Glenn Ryan
Yes.
about the inhibition of noradrenaline uptake, which I'm sure you know is how tricyclic antidepressants work.
Yes.
And so as soon as I saw that, I said, well, there's got to be, maybe there's something there. This has got to be looked into because that's like getting an antidepressant effect without taking medicine.
That's amazing, is that?
I would think so. I should think people should be aware of that, especially because they find that, in a meta-analysis, they found that most antidepressants are no better than placebo for mild to moderate depression. So this would be a great, and it's mainly because the side effects will balance out the benefits. And so what we did was we installed it at the medical school in Hawaii.
Wow.
It's the first medical school that has the system installed.
Wow.
And we started doing some trials on it,
Clinical trials.
well, not clinical trials, but at least to see if there's some case studies that we could come up with. And one of our early case studies was a 4-year, 10-month-old girl who had seizure disorder.
Wow.
And she was having 6 to 10 grand mal seizures every day.
Wow.
And within 3 weeks, it had quieted down to 4 to 5, 1 to 2 second twitches.
Wow.
And
That's impressive.
it's completely impressive. And so
Yeah.
I sent it for peer review to the Journal of Neurology Research, and it stood up to peer review. They said that this should be published. So now we have a peer-reviewed publication showing that there's
Wow.
something there. We don't know for sure what's there, but at least we now know that there's something legitimate going on.
So that really affected the seizure
It's
considerably. But
probably
does she
a
still have
90,
seizures?
90%. She still had seizures, but they're just little 1 to 2
Twitches, like
second
very small.
twitches, and she recovers
Quickly.
very quickly. And so at least we know that there's something real going on. And then we're trying to develop more case studies. I have so many case studies, but of course, that's not science.
Right.
But I have one gal whose multiple sclerosis seems to be under control.
Wow.
She's not taking medicine anymore.
Wow.
I have a guy who had mesothelioma.
Really?
7 or 8 years ago, they thought he was going to be gone, and he's still around. In fact, he looks better now than he did 7 years ago. I have a guy who is who's got chronic lymphocytic leukemia, and it looks like it's under control with the system. And many others.
And
People
how-
saying
how-
that their joint pains are less, spots on the skin are fading. So there's a lot of examples of
Now,
real things going on.
it would be nice for people to know what your credentials are even more.
Oh, my credentials.
I mean, just because.
Yeah, I'm a board certified. I'm an MD, board certified in preventive medicine. I have a degree in nutrition from Harvard. I have a master's degree in nutrition, and I'm a professor at the medical school in Hawaii.
Wow.
I'm associate chair of the Department of Alternative
What is that amazing?
medicine.
Yeah. So maybe we should show them the system, and how many sessions do you think usually it takes for treatment then?
It really depends. For some people, it's very short, but like I was saying, we're very early in terms of
Staging and
well, what needs to happen is more research
Yes.
and more documentation of what's happening. But so far, it looks like there's a very real effect that needs to be
addressed and
that
explored.
needs to be explored further.
Okay, so this is she has how many systems do you think she has?
This is a 16 unit.
She has 16 units.
Yeah.
Doctor? No, you can say who you are. Doctor?
Dr. Bob Rosen
Okay, Dr. Bob Rosen, are you an ophthalmologist?
by training, and I'm also the medical director of EESYS, which uses microcircuit current to repair traumatic brain injury.
And it seems like you have lots of scans that after you use the system.
Well, thereafter we use the EESYS stuff. We want to combine them because you can only do one person at a time. So think if you've got 500,000 soldiers,
Yeah.
it's hard to get them all treated. But if you put them in a large room and march them in and out, you can do it.
Yeah. So this is the system, and thank you so much for being with us. What a
Not at
pleasure
all.
to.
Right, not at
let me
all.
take a great picture with you.
Right.
Everybody would be very happy. So this is the system, and it looks amazing, and it just there's a lot of work that needs to be done, but together we're going to make a huge difference. I am really grateful for your contribution. Really.
Yeah, so it's in the early stages, but on one hand, it's harmless. It's been used for many years, and
Promising.
there's no negatives, negative side effects except some people have a tingling sensation. There's a few people who have said they get headaches, but it seems to be a detox effect, very mild, and it goes away. So I think there's one research project that's going on that's past the IRB stage, and apparently it's going to be cleared as a Class 1 safe medical device. But
Very nice.
so
That's really good.
so it's in the early stages of research. More research has to be done, but I think there's no doubt that there's something real going on here. We just need to document it further.
Great.
Yeah.
Dr. Rose, do you want to say hi to everybody? Hey, this is my friend, Dr. Rose, and I love her. She's amazing. Yes.
You too.
Oh, what a pleasure.
So glad you're here. Aloha.
Aloha to
Celebrating.
everybody. She loves you all. We love you.
Waves of aloha.
I'll bring you more and more from Aloha. Bye-bye.
Mele Kalikimaka.
Aloha.
Ah,
That's Merry Christmas, Mele
Merry
Kalikimaka from
Chri-
Hawaii.
Thank you.